Hello, everyone. My name is Maribel,
And I'm Daniela.
and today we will be discussing about vitamin C and type 2 diabetes.
So, vitamin C, also known as ascorbic acid, is a water soluble vitamin that functions as an enzyme cofactor and antioxidant. It plays an important role protecting free radical induced damage. The, the body is unable to synthesize it, and therefore it must be obtained from the diet. It is commonly found in fruits and vegetables, specifically citruses and organ meats. And the deficiency can cause scurvy, which is a weakness and fragility in connective tissues in the body.
And then for type 2 diabetes, it is a metabolic disease that is resulted from insufficient insulin secretion or insulin resistance, in which the cells are unable to uptake glucose from the blood, leading to hyperglycemia. And hemoglobin A1C is a blood test that is done to estimate the average amount of glucose in the blood over the past 3 months. And it's used to screen for or manage diabetes. Normal levels are less than 5.6, and for diabetes, it is greater than 6.5.
And we have the positive claim, which states that yes, taking vitamin C can be used to treat type 2 diabetes by lowering hemoglobin A1C.
Research has shown a positive impact of using vitamin C supplementation to improve hemoglobin A1C levels. So, for example, in Article 1, a meta-analysis from 2023 was conducted to investigate the impact of vitamin C supplementation on the glycemic profiles of patients with type 2 diabetes, including HbA1c. 22 randomized control trials were selected that included adults with type 2 diabetes, a control and placebo group that lasted more than 2 weeks, and the use of vitamin C supplement only. 18 randomized control trials indicated a significant reduction of HbA1c in the vitamin C treated group compared to the control. So in conclusion, this meta-analysis showed a significant decrease in the serum levels of HbA1c when patients were given a supplementation of vitamin C greater than or equal to 1,000 milligrams for a duration of 12 weeks or longer. And then in Article 2, a 12-week randomized double-blind placebo-controlled trial studied the effects of vitamin C supplementation with metformin medication on fasting and HbA1c levels in type 2 diabetes patients. 70 patients were randomly divided into the placebo and vitamin C control group. The control group was given 500 milligrams of vitamin C twice a day with the 500 milligrams of metformin twice a day as well. And it was concluded that the oral vitamin C supplementation can be given with metformin for type 2 diabetes treatment since there was a reduction of HbA1c levels in the treatment group.
And article number 3, conducted in 2022, included a 19-year-long study that focused on mortality of patients diagnosed with diabetes. Vitamin C serum levels were analyzed to determine correlation with diabetes diagnosis. This study concluded a positive correlation while using the NHAIS starting in 1999 to determine the dietary vitamin C intake and serum vitamin C supplementation in these populations, including people with pre-diabetes diagnosis and a diabetes diagnosis. They found that A1C levels increased as BMI index increased, and adequate vitamin C intake, vitamin C supplementation, and normal vitamin C levels were all associated with reduced mortality risks. For article number 4, a 6-month cross-sectional study conducted in 2022 included 42 participants to determine the relationship between vitamin C hemoglobin A1C and diabetic foot ulcer microbiome. This study concluded that an altered microbial community was seen in diabetic foot ulcers, where an instance of low vitamin C levels in the hemoglobin A1C group versus the non-diabetic controls. Although further research is needed, there was a clear association present between diabetes, diabetic foot ulcers, and vitamin C.
So in conclusion, taking vitamin C can be used to treat type 2 diabetes by lowering hemoglobin A1C. The possible mechanism is that in diabetes, high blood sugar levels can lead to the production and development of reactive oxygen species, which can cause oxidative stress. And this oxidative stress can actually cause impair insulin sensitivity. Um, Vitamin C can help reduce the glycation by competing with the glucose to bind to the proteins, reducing HbA1c and reduction of inflammation, since vitamin C has anti-inflammatory properties to reduce the insulin resistance.
And overall management of vitamin C levels is very important for lowering A1C levels in diabetes patients, and speaking with health professionals like physicians and registered dietitian nutritionists is also a great way to go about diabetes regulation with vitamin C. And here are references.
Thank you.
Thank you.